A testament to my fixing of head tilt, not hair. Oh,
No, you're
wrapping up TBI March.
okay. You're good.
Oh, catch me while
Um,
I'm yawning.
okay, you're good. All three.
Okay, good afternoon. This is Rob Eminger with Dr. Charlene Godet of Resiliency Brain Health. We're wrapping up the month of March, Brain Injury Month, and it's my turn. So most of you know me from being around the different events with Defenders of Freedom, and Don had asked me to fill in today, so here I am. And what we're going to do today is just talk about a little bit of I've personally been through the treatment, um, maybe a little bit of what I experienced, and then get feedback from Dr. Gday on what she sees and what they see at the clinic and how they approach a few things. So, just a little background on myself. Again, I went through the treatment. Um, I walked in maybe a little hesitant to go through the treatment, didn't think I had much of a problem, and the running joke as I walked through the door was I was perfect. Um, and so the more I I'm around Defenders of Freedom and the veterans and the doctors, of course, I hear that more and more that the veterans are a little hesitant on what they're getting into. Um, what is it? A little scary, and you have to almost uh, you're feeling vulnerable, because there are things that maybe you're experiencing that you don't understand, um, that you think that's just the way it is, that's my life, and that's just not true. So again, I was a milder case coming through the door. I was pretty high functioning, but deep down inside, I knew I was working hard just to function at the level I was at. So again, you get used to a norm, right? You get used to the compensation of okay, I know I have shortcomings. I know I have memory issues. Maybe I'm a little depressed. Maybe um, something my memory isn't working correctly, and so you get used to that and you just carry on your life, right? So when Donna asked me to do an evaluation with the clinic, that was my eye opener, my truth, and speaking with the doctors and everything, the biggest uh, thing I can say for veterans walking in the door and actually saying, okay, I'll do an evaluation, is being completely honest. You're going to get out of it what you put into it, right? And I don't know, do you see a lot of hesitancy with the veterans when they walk in and
I do.
don't really want to open up and
Well, I think most of you guys are thinking that this is going to be the same medical appointment you've been to time
right,
and time again, whether it's been the VA or some other, organization. And so you come in and you tell, the few things that you think you need to talk about.
right,
And then after you realize, one, we've actually looked at all the paperwork you've sent in,
hmm,
every piece of paper, every image, everything. We've looked at it, and we start to ask you questions about it.
right,
Then there's a moment where you're like, okay, well, maybe they do know something about me,
hmm,
right? And then as we start to ask more and more, there's a, how do you know this about me? I didn't write this down anywhere in my paperwork. And then we get a little further in, and that's at the point where you realize that we're here to help, and we're going to help you with anything and everything we know about. And one of the conversations we always have is, even if you don't think it's brain related, if you're having a challenge with something, that's what I need to know about. Because most of us don't think about how the brain really controls everything, right?
right.
So there's definitely some hesitation that we deal with when you guys come in.
And I think that's what amazed me is off of the evaluation when you're formulating the plan, it's
Hmm.
so comprehensive and it's so tailored to you. And again, as a veteran, we're not used to that type of
No.
treatment, and we're just not used to we're used to going to a clinic. You're in, you're out, and there's no real personal approach to what's really going on. And
Mhm.
back to your other point, I didn't myself going through that evaluation and then talking, and figuring out a plan for myself.
Mhm.
There were some things that I didn't even realize contribute to the problem, um, which again, I wouldn't have even thought about. But
Mhm.
you all, the doctors, pick up on it very quickly, and incorporate that into your plan. And then separate from that, on one of the other webinars, they spoke about the blood work.
Mhm.
There's that piece too, and how that ties into how your brain is actually functioning,
Right.
which I would have never even thought of.
Right. And most of you guys don't.
Right.
So realizing that the brain, here again, controls everything, we have to look at chemistry. We have to know what is or isn't working, right? And so if we just merely try to do some brain rehabilitation, but we're not looking at one, what goes in, and two, what's coming out, then we're doing a disservice because your brain is never going to heal like it needs to if your chemistry isn't right, if your diet isn't right, if you're not sleeping, all
Right.
of these things. So chemistry plays a big role in everything that we do.
Right. And then part of the plan, as I started going through the treatment, what I noticed, because there were other veterans in the clinic at the time, what I noticed was, I may take you may apply the treatment differently to me because of what's going on with me than another person. They're going through, like, say, they're still doing the gyrostem, they're
Right.
still doing TMS and Burtec and the rebuilder and things like that, but the approach is tailored to
Hmm.
that veteran,
Right.
which I thought was very impressive. Um, so, I mean, that to me, again, just to reiterate, I've never had that before,
Right. And
and
that's one of the conversations we had. You'll see other guys in here, and they may be doing some of the same type of therapies that you're doing, but they may not be doing it for the same reason.
right,
So if we're doing medical rebuilder with you, are we doing it because you need better blood flow? Are we doing it because you have neuropathy? Are we doing it? What are the reasons that we're using this therapy on you? So three of you may all do the same type of therapy, but all different for different reasons and applied a bit differently for each one of you.
right. I know for me, I presented a couple different things during my treatment, and again, it wasn't. I always make the joke. It wasn't the doctors taking a note and going, "That's interesting,"
Right.
and just kind of brushing over it. It
Hmm.
was, okay, stop. Let's formulate a plan right now to figure out what's going on and why it's happening, and then how do we get it working again,
Right.
right?
So as you're in the clinic and as things are improving, your treatment plan has to be dynamic.
Hmm.
And so if you come in and you've had a couple of really good days and then you come in and say, I have the worst migraine. I need to work on this today. Well, trying to push you through the treatment plan that we scheduled for you isn't beneficial because your brain is not going to do that today. So we need to stop right then and we need to handle the situation, right?
Right.
Or what I love to call, oh, by the way, doc, did I forget to tell you that? And then fill in the blank, right?
Yeah.
And so,
How do you, okay. So how often does that happen where a veteran gets to a point and they're
oh,
like, okay, I can tell them about this?
yes.
Does
So
that happen often?
100% of the time,
Okay.
all of you guys, you have
Yeah.
what I call a reserve. Most of you guys have about a 3-day reserve.
Okay.
On the third day, you're like, okay, things are a little different here. I think I can trust to tell them about these things. Or I never thought about this being a brain related issue, but you said to tell you things. And now I'm starting to see all of these other things that I didn't know were
Right.
brain related to be a brain related issue. And so on about day 3 is where we have that sit down honesty talk.
Okay.
And there's a lot of, oh, by the ways.
Yeah. So if I could offer another point to the veterans, I mean, that honesty, I guess I guess for a lot of them, for myself even, I tried to be as honest as I could up front.
Hmm.
But then you're right. I mean, I thought of things during the treatment
Absolutely.
like, oh wow, I didn't understand or know that that was connected, so I
Hmm.
didn't even talk about it. And again, gets back to it was my norm,
Right.
and so that's I just got by.
Right. It's
Uh,
I'm getting older, right? That's
yeah,
that's the most
exactly.
common one. I have 28-year-olds tell me, "Oh, it's just because I'm getting older, doc." I have 50-year-olds tell me, "Yeah, it's just because I'm getting older, doc." Right? So we've been conditioned to when something isn't going right, that it must be just an age-related issue and that we're just going to have to live with this,
Right,
right?
right.
And that's not true at all.
So veteran gets through the treatment,
Hmm.
and again, the it doesn't stop there.
Right.
Um, most most veterans come through for 2 weeks,
Hmm.
some for a little bit longer sometimes.
Right.
Um, and then it's you're not sent away like, okay, good luck, have fun in the world. You're sent away with a plan. And again, the plan is only as successful as how you apply it to yourself and how
Right.
you actually stick to it, right? And I'll freely admit, I try very hard to stick to my after treatment plan, and I have. There have I fallen off the wagon, so to speak, or like had some lapses.
Absolutely.
Absolutely, but I always tell myself, that the donors and the doctors and everybody invested a little bit in me,
Hmm.
a lot actually, and so I try very hard to keep up with it. And the interesting thing is, what we're going to be working on here in the future a lot more is with Defenders of Freedom is bringing the veterans that have been through the treatment back to the clinic to
Hmm.
go through for another week. Now,
Hmm.
what I've been through that. I've
Right.
I've done that, and what it showed with my aftercare and applying myself to my aftercare is I came back through, and when I was going through the different treatments, my numbers had not fallen off that much.
Right.
Um, so it just proved to me that yes, it does work, and it's very important to keep up with it. But as far as what are the things that you see that with the veterans that have come back through, have you seen kind of a steady
I'm
or
going to say pretty much
yeah?
when they come back through, they're maintaining,
Okay,
right? We, as far as drops in numbers, I can't really say that we've seen any of that. We
okay,
really see people maintain. Now, most of you guys actually are still improving,
good.
right? So you leave and we continue to get good progress reports and things, and then you come back and we do all of the evaluation again
Hmm.
and see where you're at after a year. And so we have good continued progress.
Right,
So that's a great starting point for the next week. So we have, again, when you leave with another plan.
right.
There's another plan you're going to have, and you're all every patient you're going to do really well, and then as you start to feel better, you're going to start to forget,
Mm.
and then you're going to call and say, "Hey, doc, I'm not doing so well today." And my first question is, "When's the last time you've done your homework?"
Right, right.
And then you get back on track. So it's human nature. We all fall off when we're good. We all jump back on when we're not. And so homework, that's how your homework is meant to be.
Yeah, you get out of it what you put into it, just
Hmm.
like anything else in life, and so I do. I try, and I'm full disclosure. I'm very fortunate. I'm right here in Dallas,
Hmm.
so I can swing by the clinic anytime. And normally it's to see other veterans and see how
Yes.
they're doing, but I can also, while I'm there, say, hey, doc, something's going on. So I'm fortunate in that regard. But as far as veterans getting in touch with the clinic, I don't think that's
No, so you guys, y'all have direct access to us and to Defenders of Freedom. So at any point, you guys, if y'all need something, some people choose to contact Donna and say, "Hey, Donna, I need some help." Some people contact us and say, "Hey, Doc, I need some more help." And so we welcome it. I think we had 3 visitors in the clinic this morning, guys that have all gone through the program, decided to stop back through this morning to see who was in, to say hi. The
Right.
buddy program, just wanted to tell you guys to do the work and to do really well. Yeah, there it is.
My buddy
Uh,
bracelet.
to
Thank
do
you,
the work.
Kelsey.
Thank you, Kelsey and Brass and Unity. But that's exactly what it is. So go ahead, Doc. Or
Yeah,
Rob.
right.
Sorry.
Yeah, so we're gonna wrap it up for today, and thanks for tuning in. Thank you to all the veterans that have come in and participated, and thank you to the doctors. Thank you to the donors, especially. That's all we got today, guys. Thank you.